Hi, my name is Christy Baxter, and this is my daughter, Kayla Baxter. And we are here with you today to record an assessment of the skin and abdomen. We're going to look at the hair, skin, nails, and abdomen for my Nursing 650 Advanced Health Assessment course. Before we get started, Kayla, do you give me permission to record this video?
Yes.
Do you have any areas of concern before I start the skin assessment? Okay, great. So the first thing I'm going to do is wash my hands and ensure proper lighting. I'm going to take a look over your arms and your legs. I'm going to notate any color variation, any changes in color. I'm going to assess the skin temperature with the backs of my hands, making sure I don't pick up the heat in the palms of my hands. I'm looking for moisture and skin turgor. Your skin seems very moist. When I tent your skin and pinch it up and release it, the skin immediately returns back to its normal state, showing good signs of skin turgor. I'm then come down to the hand. Your hands feel the same on both sides, nice and pink and warm. I show no signs of clubbing in the fingernails. Capillary is less than 2 seconds. And there's no signs of cyanosis indicating a peripheral or a central issue going on. As I'm also looking at your skin, I'm going to take a look at any abnormal lesions, macules, papules, any vesicles, any cafe au lait spots, or abnormal nevi, otherwise known as moles. I do see one mole here that I would actually look at, and how I would assess any irregularity would be using the ABCDE method, standing for any asymmetry, any irregular borders, any color variation, a diameter greater than 6 millimeters, or an evolution in size. I don't see any of that here. This looks like a completely normal mole. So no need to refer to a dermatologist or any other type of specialist. Okay, now I'm also going to look down at the feet. Same thing for looking for any cyanosis bilaterally. She doesn't have any. The feet are pink and warm. Capillary refill time is less than 2 seconds. And there's no signs of cyanosis indicating any sort of peripheral issue or central issue going on. Your skin looks fantastic. Now I'm going to work my way up to the face. Your face looks amazing. You have no signs of acne, which is beautiful. Your lips are nice and moist, showing no signs of dehydration. I'm going to inspect your sclera. If you can look up for me, that's the white parts of your eyes, identifying if there's any form of jaundice or yellow in the sclera, which could indicate liver disease or hemolysis of red blood cells. And we'd really want to look at that a lot further for further testing. You don't have any of that, which is great. I'm now going to go up to the scalp. I'm going to identify any lesions, dryness, dandruff, how the hair is distributed, the characteristics of the hair. Does it seem to be just breaking off? Is any falling out? Any signs of lice? Any signs of eggs or itchiness in the scalp? Do you have any issues with your hair currently?
No.
Okay, fantastic. Well, your hair looks great to me. Your skin looks great to me. So now we're going to actually move on to the abdominal assessment. But before we do that, do you have to go to the bathroom?
No.
Okay, fantastic. Are you able to scooch back and lay down on your back for me? And put your hands at your side. I will help you with the drape. Normally, I'd have them bend their knees as well. So you can scoot down a little bit more, have your head on the pillow just to keep you a little bit more comfortable. I would bend the knees, but sake of the video, I'm going to have my patient keep their knees straight for me. What I'm going to do is I'm going to take the drape and I'm going to go right above the pubic bone, keeping the patient comfortable. I'm then going to put her shirt up right below the nipple line, ensuring that she's comfortable, but that you can see the entire abdomen. Okay, so the first thing you want to do with the abdomen is you want to inspect it. You want to look for any contour, the shape. Is there any asymmetry? Are there any lesions or rashes? Is there any dilated veins? Are there any striae, any scars? Do you see any pulsations? And I see nothing. The abdomen looks absolutely within normal limits. Okay, so now what I'm going to do is I'm going to auscultate. I'm going to listen to all quadrants to listen for bowel sounds. So I'm starting in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. All bowel sounds are equal and normal active and present in all quadrants. So now what I'm going to do is I'm going to switch over to the bell of the stethoscope, and I'm going to listen to 4 different arteries. I'm going to listen to the aortic artery, which is right above the umbilicus. I'm going to listen to the renal arteries on the right side and the left side, right below the aortic artery. I'm going to come down below the umbilicus on the right side, midclavicular line, listen to the iliac artery, and the left side, the iliac artery. Then come down a little bit further and listen to the femoral artery and the femoral artery on the right side. And what I'm listening for is any bruits or whooshing sounds. I'm then going to go ahead and listen to the liver, which is on the right side under the costal margin. And I'm going to listen to the spleen on the left side, 6th rib. And what I'm listening for are any venous hums or friction rubs. And I don't see any of those, hear any of those. So the abdomen exam so far is normal. Now what I'm going to do is I'm going to percuss each quadrant. And I'm listening for a tympanic sound. It's a high-pitched sound that indicates that there's air or gas, which is a normal sound. We wouldn't want to hear a dull sound in any of the quadrants. That could indicate fluid in underlying organs, which would be an abnormal sign. All quadrants of yours, all 4 quadrants of your abdomen have a tympanic sign, which is within normal limits. So now I'm actually going to examine the liver span. So what I do is I palpate the anterior chest, the lowest level of dullness, all the way to the top area of dullness, and notate the distance between, which is the liver span. And then I'm going to palpate the spleen, which is over at the 6th rib. And I hear a high tympanic sound. So I'm going to ask the patient to breathe in deep. And I hear a high tympanic sound again, which that shows a sign of there is no splenomegaly. If there was a dull sound, you could think questionably, potentially there was a splenomegaly, which is an enlarged spleen going on. All of that is normal. So now what I'm going to do is I'm going to lightly palpate the abdomen in each quadrant, showing for any signs of grimacing or resistance. Is there any tenderness doing that? So you're looking for tenderness, any masses, any grimacing, any guarding. Patient doesn't have any of that. So now I'm going to deeply palpate. And what I'm looking for is the liver edge, the kidneys, and any tenderness or abdominal masses. Okay, when you deeply palpate. So there's no tenderness or abdominal masses when I deeply palpate. Now I'm going to place my right hand up under the costal margin. I'm going to ask the patient to take a deep breath. And as they take a deep breath, I'm going to try to feel for that liver edge to slide underneath my hand, descending down to try to feel for the texture of that liver to see if I can identify any abnormalities. Most times the kidneys are not palpable. The right kidney might be palpable on a very thin person, but what we can do is identify to see if there's any kidney areas on the back when we get to the end of this exam to assess for costovertebral angle tenderness that could indicate a kidney issue going on if you're not able to palpate it. The other thing that we can do while we're here is we're going to look at what's called Murphy's Point. Murphy's Point is assessing the gallbladder and spleen area. So what I'm going to do is I'm going to have the patient, I'm going to press underneath the costal margin. I'm going to have the patient take a deep breath, keep breathing, 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 breathing. Did you have any pain when you did that? Patient never stopped breathing or breathed in due to pain. So that indicates a negative Murphy sign. So that means that the patient does not have any signs of cholecystitis, pyelonephritis, or anterior cholangitis, which is a great sign. The last thing I'm going to do is look at 4 other special characteristic areas that could potentially mean that a patient is having appendicitis. The first one is McBurney's point, which is underneath the umbilicus, in between, it's actually down from the umbilicus near the anterior superior iliac spine. There's a point right there in the right lower quadrant called McBurney's point. If there's rebound tenderness when you lift off from pressing in and the patient has pain, that can be a sign of appendicitis. Okay, there also is another sign called Ravsig sign. If I put pressure on this left side, does the patient have any pain on the right side? Did you have any pain? No, so that's a negative Ravsig sign, which is a good sign. The next one is a So sign. I put my hand on the patient's right knee and I have them lift their thigh up towards me. And is there any pain in that area? No, so that's a negative sign. That's a good sign as well. The last one is the obturator sign, which you're gonna flex your, point your toes to the sky, bend your knee for me. And I'm gonna help you bring your knee in. And then what I'm gonna do is rotate your leg internally. Do you have any pain when you do that? Okay, excellent. That's a negative obturator sign. All right, excellent. Can you, we're done the front part. Can you slowly sit up for me? And then while you're sitting right there, you can stay comfortable just like that. I'm gonna just take a quick look at your back, assessing for any abnormal lesions or nevi. I see none. Your skin looks great. It's nice and pink and warm. I'm gonna check to make sure your kidneys are good, which is placing my non-dominant hand on the 12th rib and the ulnar side of my fist. I'm going to lightly tap both sides. Did you have any pain when I did that? Okay, excellent. That's a good sign that the kidneys are in working order. All right, now slowly be careful and swing back around towards me. We have just completed the full exam. Do you have any questions for me? No. Well, I thank you so much for allowing me to take the time and videotape you for the skin, hair, nails, and abdominal assessment for my Nursing 650 Advanced Health Assessment course. Thank you for watching.